massive challenge right now that we could come together as a tech company to solve is we are absolutely losing track of contacts to cases. And the way we know that is because every single new case that keeps popping up is in no way connected to other cases in any sort of system, but we know that they're connected to cases. So the fact that when a new case comes up, that they're not in a system that says they had a contact to a previous case tells us we have no active system. So if we don't start seeing every single case that becomes Ebola is somehow already in the system as a potential contact, until we get to that point, we are continuing to have a spiraling epidemic. So that's where we are. We must figure out a way that absolutely every single person who had a potential contact to someone with Ebola is somehow monitored for 21 days. Sounds simple. It really is that simple, but the reality is we've done nothing to implement that kind of technology because it's in an area of the world that doesn't even have a public health infrastructure, let alone a medical infrastructure. So what we're getting as Skull Global Threats Fund, because we've been working on technology mainly in Southeast Asia around bird flu, because we're really worried about a respiratory disease that will spread around the world, and most of the respiratory diseases are coming out of Southeast Asia, bird flu, SARS, and so forth. We have West Africa as an area that's in our strategy to build a network, but quite honestly, we have to tailor sort of our priorities, and it was felt like most of the stuff that comes out of Africa is a bloodborne pathogen or something like Ebola, and historically, Ebola has always popped up and burned itself out. So now we have the case that that's not happening. But at the same time, there's absolutely no reason we can't move technology and to try to follow every single potential contact. And that's what we're working on. So we're not only working with CDC and WHO to try to solve that issue, we're trying to figure out, and here in this room are probably lots of good people, including ourselves, that have given money to all the frontline people. But if the frontline organizations are not somehow connected into a surveillance system, so MSF's data is contributing to partners in health data, and somehow all of that is coming to the Emergency Operations Center, that's what we need to do. So instead of giving more money to these organizations ourselves, we're saying, let's figure out who's not funding technology, and let's put our money into solving the contact tracing, and then give it to those organizations that are already giving the money to do the patient care and everything they need, but say, hey, here's a little more money because we need you to be using this technology because that's what everybody's using for this outbreak. So that's one of the really concrete needs that now is not only a need for West Africa, but we've basically been on the phone nonstop for the last 24 hours with our own US government with the issue that we need to have a system here now that we start having cases that anybody coming from any of these endemic countries, of which, believe it or not, 150 people every day land in the United States that are directly coming from those 3 countries. So we need to implement a system right now that everybody who fits that screening criteria is reporting for 21 days. So we can't lose track of contacts. That's basically what it boils down to. And we can solve that. I mean, that's a totally solvable problem, because if we have the mindset to wait for the vaccine or wait for the drug, it's too late. And many outbreaks can be controlled with this kind of effort. And we're so fortunate that Ebola doesn't spread until you have symptoms. So we have it in our advantage to actually create a system to have people report immediately. So that's one big area that we hope by next week to be able to have a single system that has a hotline, iPhone app, Android app, and a web base that literally not only could be used by us, but could be used by any country that needs to be doing that kind of surveillance. So that's one big need. I think the other big need that falls into lots of expertise in this area is we need a diagnostic, a really rapid diagnostic. So the diagnostics we're currently using for Ebola literally require your virus load to be high enough that even if you have symptoms, it might take 3 days of having symptoms before the test that we currently use becomes positive. So that's why when the test is negative, they say we have to repeat it in 3 days to make sure it's positive. Well, we think there are people in Silicon Valley who have the kind of technology that literally could amplify some of those genes and maybe even help us figure out, that a test will be positive the moment you have symptoms. And the reason that's important is because right now what's happening with contact tracing, and the reason you're seeing a lot of social disruption, is because obviously everyone with a fever in West Africa doesn't have Ebola. In fact, your probability of having Ebola compared to malaria or flu or now Marburg virus is also circulating. It's that season for that. So unless we're able to say, you have Ebola or your fever is due to something else, we're not even helping solve the social unrest that's happening just because we don't have a simple diagnostic. And that diagnostic is going to be in high demand when we start having imported cases like we're seeing in the US and Spain. And that's something we've been working on as a foundation, because we don't understand how are we supposed to find the next emerging pandemic threat when we don't even diagnose outbreaks anywhere in the world with ruling out things because of diagnostics. So it's a big, big issue, and we think there are some solutions right now that probably could be moved to help with Ebola. And then lastly, the issue that really is probably one of the driving factors of why this Ebola outbreak is different. As Larry said, this outbreak occurred at the border of 3 countries. And the one thing Skoll has been working on in partnership with the Rockefeller Foundation and Gates is building these regional networks where neighboring countries are working together. And we're happy to say we've invested in South Africa and East Africa, and those 2 networks have already come together, spent 2 days preparing for Ebola, so they're ready. Had we had something like in West Africa, it's hard to tell, but we certainly will have something in West Africa at the end of this. But allowing countries to work together is absolutely necessary for pandemics. So the technology we need right now has to do with contact tracing, has to do with building the ability that we can do it, even if it means giving out phones for the 21 days that people don't have a phone. That will be a lot cheaper in the long run if we had to give out 100,000 phones for the rest of this outbreak than have 1 million cases of Ebola. So some of this really is about thought leadership, technology itself, whether it's devices or engineers or so forth, and the other really is, and then it's going to take more money than we have, collectively, because all of that has to be rolled out, and certainly we're going to have to take care of all the people who are sick with Ebola, and that's a crisis in and of itself. But if we don't stop getting new cases, it won't matter how or what we're able to do with those people currently infected, other than obviously important for their health. But if we're talking about stopping an epidemic from becoming a pandemic, we still have time, but we don't have time to waste.